For a lot of patients who have knee problems, you'd be surprised how, yes, there are going to be problems in the knee, but a lot of times there are actually problems in the hip and the ankle. And so when you focus mostly on the knee, you are going to miss out on the root cause of the problem. This is a classic example of that, okay? So for people who have a tough time standing up, or they say that each time they stand up, their knee hurts, one of the things that you want to look for is this. If a patient sits back and the feet or the knee is kind of at a right angle, okay, and then they stand like this, and then when they stand, you will see the toes come up, okay, like that, and then it takes them a little while before they get their balance. That is poor body mechanics that can create a knee problem, okay? Not only does it create knee problems, but it also increases the risk of falling. So ideally, what you need to do is, if you're seated in the back of the seat, you want to scoot to the edge. And then, so I wouldn't want to say sit on the edge of the chair, but you want to sit kind of halfway, like that. So that's step one, is to just scoot from here to like in the middle of the seat. And then the feet needs to go back. Now what I always say is move your feet as far as you can, as long as your heel doesn't come up. The moment the heel comes up, you've gone too far. So you want to move it slightly forward. Now for people who, the moment they bend it back, the heel comes up right away, clearly that means that is a problem. So that does need to be addressed. So that's step two, right? So you move your feet slightly back, making sure that the heel is touching the ground still. And then the third step is to bend forward. Some people will say nose over your toes. You want to bend forward so that the nose are right above your toes. And then from this point, what you need to do is keep that head down. And so you're actually going to lift only your hips like that. So you lift your hips and then climb back up. I sometimes say to patients that in the process of standing up, it's like you're mooning someone. So you actually go here, moon someone, and then stand up. So here's the why for that. When you bring your feet under you, the moment you're standing up, your center of gravity, which is 2 inches behind your belly button, is immediately between the 2 feet. And so when they are between the 2 feet, you immediately become more stable. Now picture this, if you don't do that, if you don't take the time to bring the legs back so that you leave your feet here, like so, and then you're going to stand up from here. When I stand up, my center of gravity is actually behind the 2 feet. So I will have to take a second or two to pull myself forward to bring it to the right place. And that is why people who do it this way feel a little unstable, because when your center of gravity, which is really the heaviest part of you, if it's not in the right place, let's say it's slightly back, guess what happens? You are going to feel as if you're going to fall backward. So again, that's so important. A third thing I want to point out is for people who have knee problems, if you leave your feet in the wrong place, biomechanically, and by biomechanical, that means the relationship of the bones to how the muscles are being asked to work, or conversely, it's the relationship of the muscles to the bones, essentially what it is. So what happens if you're in the wrong position, as in this way, is in order for me to stand up, I will have to use my quads a lot in order to make it happen, right? So if I do it this way, I can literally feel my muscles working really hard, and that's also why it creates pain. Whereas if I go here, watch this, when I stand up, the knee actually moves slightly forward before you stand up. And that is the right way. It's just biomechanically correct. So remember, but the one thing too is I don't want people to do this. I don't want you to consciously move your knees forward before standing up, because if you are not stable, it could end up on the floor. Okay?